If you're thinking about getting the TPLO surgery, which stands for tibial plateau leveling osteotomy, or the TTA surgery, which stands for tibial tuberosity advancement for your dog, I hope this video helps. First, we noticed Otto had been limping and not putting any weight on his left rear leg. We checked the pads of his paws for any cuts or foreign objects like thorns or needles. We also checked for bone fracture throughout his leg by slightly maneuvering his leg. After all that, we didn't find any obvious injuries. We took Otto to his vet and they performed x-rays on his leg, but the results were inconclusive as to any damage. Our vet then referred us to a specialist, so we suggest you take your dog to your vet before moving forward on any major procedures. We ended up taking Otto to two specialists, one that specializes in the TPLO surgery and one that specializes in the TTA surgery. The information we gathered from both specialists is that the TTA is a less invasive procedure than the TPLO. The TTA uses a titanium plate that helps avoid the buildup of bacteria to prevent an infection on the surgery location. Should your dog need surgery on both knees, the procedure can be performed at once if doing the TTA. The TPLO is more invasive and can be done only one knee at a time, preferably 1 to 2 months apart for ideal results. Typical recovery time for the TTA is shorter than the TPLO. However, it is advised to keep your dog confined or in a controlled setting for the first 2 to 3 months after surgery on both surgeries for the best results. The TPLO seems to be a better option if you have a larger dog due to the process of the surgery and long-term recovery. The price of both surgeries is just about the same, so that was not a factor in our decision on whether to get one or the other surgery. The cost is about $5,000 per surgery per knee, and if you're getting both knees done, then it'll be double that. Ultimately, we chose to go with the TPLO with Otto just as a personal decision. Please note the cost for auto surgeries in the New England area, which is where we live, was $10,000 approximately. We don't know if the cost varies depending on your location in the country, but I assume it is similar no matter where you are in the United States. The size of your dog will also be a factor. Our dog Otto is a large breed. If you are getting the TPLO surgery performed on your dog or perhaps the TTA instead, we suggest you prepare prior to the surgery with purchasing some items. It is very important to keep your dog in a very small area, such as a kennel or gated playpen, at least for the first 2 months. We bought Otto a gated baby play yard. The dog will not be allowed to walk around freely, play with other pets, jump, or run. When taking your dog outside to relieve itself, you should have a leash on hand since the dog will need to be on the leash at all times when outside the gated area. If you have other pets in the house, separate them from the dog to prevent them running around or accidentally hurting him or her. We also purchased a small ramp to have Otto go up and down our backyard deck and get in and out of our truck. If you also have a large dog, we suggest you purchase one to avoid the dog hopping onto your vehicle when transporting. We live in a two-story home and he is not allowed to go upstairs under any circumstances. Perhaps the most difficult thing to do, but equally important, is consider how to keep your dog confined throughout the day. Luckily, my wife and I work from home and we keep an eye on him all day, every day. Especially during the first month, the dog will be very delicate. The dog must keep the cone on at all times, including while sleeping. This is to prevent your dog from licking its wound and possibly cause an infection. Otto wasn't very happy to have his cone on all day and would fuzz to the point that he would bleed on his gums. We bought him a soft cone, which can be purchased online or at any pet store, and that really helped. Try to prevent as much as you can from having your dog step on very cold and hard floors. We bought Otto some interlocking foam square tiles, which can be purchased at any home improvement store. Also, take into account where you live and the time of year when you will have the surgery performed. If you live in an area where it rains a lot or snows and the time of season is here or approaching, you might want to take that extra precautions or wait until the weather gets better. Since we're in Massachusetts and it was in September, we decided to get the surgeries done immediately. Had we not gotten them done immediately, we would have waited until after the winter months. With that being said, the wound area cannot get wet at all. So we clean Otto with wipes since we cannot wash him, but make sure to avoid the wound area. Since this is a specialty surgery, chances are you'll have to travel some distance to get the surgery done and for the follow-up visits. We purchased Otto a soft, collapsible kennel that fit in our truck to keep him confined during our long trips. We had to travel about 5 hours round trip to the doctor, so take that into account. His follow-up visits were 2 weeks after his surgery to remove his stitches, 1 month after surgery to get his x-rays to make sure everything was internally good, then 3 months after surgery for a final checkup. Our doctor allowed us to get his stitches removed by our local vet to avoid us having to take an extra long trip. Check with the specialty surgeon and your vet if that'll be something you could do as well.
Live from NPR News in Washington.
Otto's appointment at Performance for his knee surgery. First out of two.
Public school system will be returning to in-person classes for the first time in a year and a half. NPR's Rosemary Mizeri says a number of measures are in place.
Otto had to stay the night at the surgeon's office as normal procedure, and we picked him up the following day. The shaven area on his front leg is where the incision for the ID was inserted. Wednesday, September 15, 2 days after his surgery, which was Monday. He's putting some weight, not too much. Still pretty swollen here, but it's been coming down slowly. The single stitch that can be seen below the surgery area is for a nick that is made in the skin for a rotation pin which holds the TPLO jig. The jig holds the bones together while the plateau is rotated and until the plate is placed across the bone osteotomy. By week 2, the wound was scabbing and healing properly, and the redness and swelling was diminishing. September 28, 2 weeks after his surgery, he had his stitches removed, and we were given instructions to begin exercising his leg by stretching it 5 to 10 times a day, 5 times each time. His doctor informed us everything was healing correctly. Used to be walking pretty normal. For the past few days, we notice if he stops like this, he won't sit down, meaning we don't believe he's in pain when he's just sitting or standing still. He puts weight on his leg. One month after his surgery, he had his checkup with his doctor and had x-rays taken of his leg. Everything is good. He was allowed to start going on short walks. Also, while there, we scheduled his second surgery for his other leg, which would take place in 1 month, November 16, 2021. After his second surgery, we did everything the same as we had previously done for his first leg. However, since we had already gone through this once, we would at times be complacent with certain things. He too had figured out that he felt physically more comfortable and sometimes get rambunctious. So it is very important that you keep yourself and your dog disciplined as the time goes. In the event that you decide to do both legs on your dog, check with your doctor if you can combine visits for both legs. For instance, on one trip we took was month 3 of his first leg, and at the same time was month 1 for his other leg. Our doctor advised us not to wait too long for his second surgery, as it could possibly be detrimental on one of his legs if our dog would be too dependent on just one leg. But the situation can be different with your dog. We are not medical professionals and speak only from our personal situation. Please consult with your veterinarian and specialist as to what can be best for your pet. Our dog had his surgeries at Performance Canine Surgical Center in Harvard, Massachusetts. For transparency, we are not sponsored by or affiliated with them. We're just happy and satisfied patients. As of the recording of this video on December 24, 2021, Otto already had his 3-month checkup on one leg and 1-month checkup on his other leg. We will provide updates as time goes. Thank you for watching and good luck.